Let me
I'm not able to see the screen and the slides, so yeah,
just a second.
starting.
Sorry about that. Cool. Can you see it
So
now?
yeah, we can. Thank you. Amazing. Can everybody see the screen? Hopefully, if you cannot, we have the chat section, and you can always drop your questions in the chat. I just did here and said hi, so you can just drop your questions here as well.
Awesome.
Okay, so tonight we're going to be talking about LinkedIn. Why are we talking about LinkedIn at Invictumed? So we are here to help you grow your practice with cool marketing ideas. We're here to help you meet strategic connections in Dubai, the UAE, so that you can build a stronger, larger network and also build strategic referrals for your practice. So one of the cool ways to get more patients is not always just to market yourself on Instagram or on Google, but it's, for example, to have doctors in your network or clinic owners that can refer some of their patients to you in case that you offer a service that they do not. And LinkedIn is actually a great place for you to do that. It's definitely underused by a lot of doctors, clinics, most clinic managers, marketing managers, are not on LinkedIn in the UAE. And a lot of the doctors and practitioners who are on LinkedIn are usually only focusing on using it for job search. So this evening, we're definitely going to tell you to not use LinkedIn just for job search. LinkedIn is a great place to build a personal brand. What do we mean by personal brand? It's a place where you're going to be able to tell all of your connections, all of your followers, who you are, what you do. You can mix professional information with some personal insights. You can build authority by sharing some of the expertise that you have and knowledge and insights. And also, what I think is the coolest about LinkedIn is strategic connections. So all the clinic owners and doctors that you would like maybe to meet at conferences or elsewhere are on LinkedIn. And it's extremely easy for you to network with them via this network platform. So maybe Nala, you want to add a couple of words on this to inspire doctors?
Yeah, 100%. I think with a lot of people or doctors, I suppose, that we've worked with, the first thing that they think LinkedIn is, oh, it's for finding jobs and to also get employees for jobs. LinkedIn is way more than that. And the thing about LinkedIn is that it's not such a crowded space. So when you think of digital marketing, a lot of the time you think TikTok or you think Instagram or you think, let's say, the usual social media platforms that everybody kind of uses. The beauty of LinkedIn is because it's not so crowded, you end up being differentiated. You don't sound like everybody else because there aren't as many people there. So whatever you post, whatever efforts you put into LinkedIn, whatever relationships you build on LinkedIn are much more special than those you make on Instagram, just because the space is much less crowded.
Yeah, very easy for you to take space on LinkedIn and write much longer posts that are interesting, to post a few photos, not just one will be displaying, but several photos. So we're going to show you how tonight. So let's start.
Yeah. Let's start
So
with, yeah, go ahead.
go ahead, Nala.
Yeah, sorry. I was just going to say, let's start with an example from one of you guys listening tonight. We thought, I'm sure that there are ways that you've built some strategic connections, and if so, whether one of you could unmute and actually share your experience with us.
Well, I'm
So
quite active on LinkedIn, I could say, and I've been there for many years. I mean, as I think as long as they launched LinkedIn, actually. And since then, I was always trying to create connections, especially in the UAE, in the UK, places that I was planning to settle in future. And I've created many connections there. And comparing to Instagram, like you attract followers and you also follow people, but on LinkedIn, the connections that you create, they are more authentic. Like you get to meet most of these people in real life. And one example is Servan, actually. First time I had a conversation with Servan was on LinkedIn. And afterwards we met. I mean, I know her from American Academy, but I mean, to talk and, to have a conversation and to get connected is something else. So I think it's quite effective. Also, I've used it for referring to specialties like, I'm an aesthetic practitioner. It doesn't much happen that I get involved in medical field, but sometimes it happens. Like my patients, they need extra care, or we accidentally find something out. So, or for example, they talk about their families, their kids, their husbands. So, they ask me for referring them to a specialist. And of course, again, LinkedIn is a great help. I ask for the doctor's number sometimes if they're yeah, if they prefer to communicate with patients directly, it's much better. I mean, for me and for the patient. So I've invited many doctors to my office through LinkedIn. I've asked them to come by. We can have a chat. We can see how we can do referrals to each other, endocrinologists especially, internal medicine specialists, pediatricians. I've met several pediatricians through LinkedIn. So yeah, for me, it's been quite fruitful, and I still okay, I'm busier now than before. I cannot do it as much as I used to do, but still I'm trying to at least create some connections every month.
Mhm. Great. Well, that's a great insight. And yeah, I love the fact that you outreach to those doctors that can refer to you and just think outside of the box of why you want to use LinkedIn and make it work for you. So if you're here on the session tonight and maybe you've not yet experienced it in that way, LinkedIn, and it's just a place that so far you've used to have a profile up and look and apply for jobs. And let us know as well, quickly unmute yourself and let us know what would you like to get out of LinkedIn and why are you here tonight? Hopefully we've already got some slides and information for you, but what would you like to get out of it?
I want to know what are the kind of posts we should be posting. Like on Instagram, it's totally different.
Mhm.
And how often should we be posting on like LinkedIn? Is it as often as on Instagram? And you said we can reach out and start talking to people. Is it like after some time of my like all of a sudden you just pop into somebody and say hi, let's meet? So I find it awkward, so I don't know
No, no,
how
it's
to do it
okay.
in a
I've done it
non-awkward
several
way.
times. To me, it's normal. I mean, we are colleagues in the end of the day. So, especially someone that I
Yeah.
regularly interact with, like they like my posts, I like their posts, or we leave comments on each other's posts. So it means somehow.
Mm.
So for me, it's okay. I
So
sometimes
after a few interactions.
Sometimes even no, like sometimes for example, once I needed to refer my patient to an endocrinologist, and she was specifically asking for a female endocrinologist. So most of the ones I know in my cycles were male endocrinologists. So I started searching on LinkedIn, and several endocrinologists came up to me, and like I saw, okay, so I messaged three of them, and I said, "Hi, doctor, I have a patient I want to refer to you. What is the way to reach out?" And it the thing is, see, for me, I send voice notes. I send if I see that that connection can add value to my network, I'll be very straightforward about it. I will tell them, This is the reason I reached out to you, and I hope we can meet up or we can collaborate in future."
Nice. That's exactly right. And the thing about marketing or any sort of outreach, even if you want to call it sales, is it's your intention and your, let's say, your inner dialogue that really matters here. If you yourself have the idea that, oh, this might be silly, or oh my God, this is, this feels like I'm asking for something, that's how it actually becomes. But if you go in with the mindset of, listen, I'm a professional here and business is business, and I think you can add benefit to me and I can add benefit to you. It's honestly not harmful at all. That's number one. Number two, if you actually speak to doctors who are well versed into LinkedIn and ones that are quite active on LinkedIn, you'll find that they're doing the same thing anyway. So it's actually nothing strange at all. Everybody is doing the exact same thing. It's the same as sending somebody a DM on Instagram. It's just a message to say, and the message doesn't have to lead with, and it's something, by the way, that we'll talk about today, so I won't go too much into it, but now I'll go into it in a bit. But yeah, there's a way to kind of word your message in a way that's, you begin with a compliment, and then you say, I really love your page, and I think that we can add benefit to each other. Let's talk. It doesn't have to be like, let's spend money and make business together and be cold about it. Not at all.
Yeah. Yeah, with LinkedIn, Dr. May, I'd say like it's a lot less judgmental than Instagram. You know, Instagram, we open the page up and we see like, okay, we can gauge super quickly if that doctor is very active, not active. But I think on LinkedIn, generally speaking, no one is very active anyway. You know, you have the ones that are not active and you have the ones that are a little bit active. So I think honesty always pays off. That's always my top advice. Like, even if you find somebody that you like on LinkedIn, Dr. May, someone you want to connect with, but you haven't had a lot of posts and content on your LinkedIn, you can always reach out to them and say, hey, I'm not very active on LinkedIn, but I really wanted to use the platform to reach out to you today. Because I think that, you know, we can have like strategic collaboration. What would be the best way to reach out? So be open about it. No one on LinkedIn is going to really check so much like if you've had a lot of regular posts or not. The frequency of posting on LinkedIn does not matter so much. So main thing is just to
The
have a
quality,
nice
maybe.
profile, and then you can build up your post little by little.
Yeah.
Okay. Thank you.
Awesome.
Okay.
Oh, yeah.
I cannot see the slides, Nala. I don't know where they've
Yep.
gone. Okay, great. So exactly. So let's look first at your profile, how it looks basically, the shop window of your profile on LinkedIn, just like Instagram. Instagram, we're very judgmental. We want it to look manicured. We want the post to look nice, the videos to look good. What do we want from LinkedIn?
Exactly.
So on LinkedIn, this is what you first see when you arrive on somebody's profile. Here, I've taken the example of a lady who is one of our speakers. She specializes in personal branding. She's not a doctor. She's a personal branding strategic person for entrepreneurs and CEOs. So she sells personal branding advice and strategy. Well, if we land on her profile and page, I'm sure you will agree that it's pleasing to the eye, it's colorful. But she's achieved this in two simple ways: only one profile picture and one backdrop image. Unlike Instagram, where you'd have to have at least 4, 8, 12, 16 posts that look really cool before somebody says, hey, that looks clean, that looks nice, that looks professional, it would take a lot more work than LinkedIn. So here, what do we have that makes it pleasing, if you agree with me? Well, we can see not just her face, but we can see half of her body. So we get more a bit of a vibe for her as a person and her style. She's into personal branding. But I like this half body shot. She wears something colorful, which makes her stand out. And the backdrop image is yellow. It has another picture of her. It has a clear message as well. So you might be wondering, how do I make this backdrop image? Well, if you don't have one, LinkedIn can suggest a theme for you, which would be something a little bit more boring, but at least something would be there with some imagery. Or you can go to Canva and you can search for LinkedIn image, and you'll be able to quickly upload a photo of you and some text. So if anybody needs help with that, we're more than happy to show you how to do it as well with a little video that we can post on our WhatsApp group. So this part is really important just to make somebody pay attention to your profile when they arrive. Then we can see that she's even used like a little icon or emoji, like a lemon next to her name, because her book is called DC the Lemon. What I like is she separated each aspect or service of what she does by a little straight slash. So to my liking, there's a little bit too much. You know, she's filling up the space quite a lot. But I see a lot of doctors are just putting dermatologist, cardiologist. There's a lot more that you can say and you can use here. You have space, use it, it's free. So for example, you could say, I'm an internal medicine doctor with a special interest in integrative and functional medicine, diabetes specialist, obesity specialist. So what are your subspecialists? What are you passionate about? If another doctor from another specialties lands on your profile and you're a dentist, what is it that's special about your dental work? your dental approach. Okay, so you can use that space to write it down here. Let's hear from Dr. May. What comes to your mind that you could write here? You're a dentist, pediatric dentist, doctor. Can you share with us maybe?
I'm very passionate about the airway and the breathing, and how it affects the alignment of teeth of kids. So I usually refer to a lot of ENT doctors to evaluate if there's any blockage in the airway, so that when I'm aligning the teeth or when I'm working on the breathing, I don't have the blockage, so that the kid can be trained to breathe from their nose rather than their mouth. So I
Nice.
can always add passionate about alignment, about airway, about proper breathing.
100%. This is great. And I would even like go as far as saying, if you are as well and you are an ENT, reach out to me. That could even go in that little bio profile. If you wanted to have a specific initiative to attract attention from ENTs. Here we have another example. It's not a doctor. I'm doing it purposely so that you can see, because I think from outside our industry, other specialists than healthcare use LinkedIn very well. So we can see Mr. Guillaume Laronde. He actually used to work for LinkedIn, so he's got a very good profile. So maybe type his name on your notebook and go and check his profile. Although he's not a doctor, like I say, he used to work for LinkedIn, so he's using a lot of tips and tricks from them. So can you see here the little speakerphone? That little speakerphone is basically, if you click on it, you will hear, like I think just a very few seconds, his voice, where he will say probably something like, hello, I'm Guillaume, thank you for coming on my profile, and this is what I do. So you have the option on LinkedIn, again, we can show you how to add like a voice audio introduction. A lot of people would not know that this is there. They would not click it, but some people would definitely know it's there. So it takes 60 seconds for you to record an audio message, and this is where it will go if you do. Is anyone using it who's with us tonight? Dr. Shiva, maybe?
No, this is available to verified profiles, or everybody can use
No,
it?
everybody.
Oh, no, I haven't activated yet. Actually, that's a good thing because most people cannot pronounce my name. So,
Yeah, so exactly. So that was actually the reason for it. So a lot of people use it to say, hey, my name is Dr. Shiva, and I know a lot of you can't pronounce it properly, and this is how it is. So you can even use
yeah.
it to show your personality, your whatever tone you want to give to it.
Yeah,
Maybe now you can make a couple of notes we can share in the WhatsApp group later on.
yeah, 100%. Um, so I was going to say the thing about marketing and branding is you have to market you as an entity and you as a person rather than or not rather, but alongside the business side. So what I mean by that is people don't generally buy into what it is that you do, they buy into you doing it. So by adding these little details of, the speaker or your audio or your sound to your profile can really personalize your brand. So it's not just a brand, it's a personal brand. And I think people are much more likely to want to connect with you, work with you, be your patient, whatever it is, if they can actually hear and see you.
Yeah, absolutely. And here, what I love, sorry, Nala, if we can go back
Mhm.
up, is you can
Yep.
see that now the big trend in marketing is to say how you help people, right? So you're basically touching upon what we call the pain points. So especially in medicine, you're definitely a doctor that is here to fix pains and problems and concerns. So if you wanted to be just straight and a little boring, you would just say dentist or pediatric dentist. But if you want it to be like more catchy, you would say, I help, I am passionate, or I empower kids to breathe better through XYZ. Or I empower women and men to look and feel beautiful. And then next, aesthetic doctor, passionate about beauty from the inside out. That is just an example. Immediately, it will reflect passion and it will talk about you rather than just your specialty. If
Yeah.
you're in the business of medical tourism, like Victoria saying, you could put very clearly that I connect patients to world-class medical services overseas, including Germany, just an example.
No. Awesome.
I like to visit my website as well. Sorry if we can go back up. So don't forget that on LinkedIn, you can always redirect people to your website if you do have one. And this is an example here in the second button, my website.
This one. Nice.
So LinkedIn has a services section as well. So I wanted to highlight that feature. So here you could simply create different services. It's very simple to use, by the way, LinkedIn. I would be more than happy to even do like a little video with the screen sharing where I can show you how to do it and find those buttons. But you can very clearly show the different sub-services that you offer within your specialty or within your area of activities.
Yeah, I also want to touch on a little bit. I feel like with Instagram and other social media platforms, it is a bit more difficult to navigate your activity, your performance, your everything else. The beauty of LinkedIn is that it's so simple and so user-friendly. So I would challenge everyone to take at least 15 minutes each week and just try to optimize your page in one way, at least. Every week have a look and see what can I do better? Is there one thing I can add? Is there any additional buttons that I can click for me to yeah, see a return maybe in a week or 2 weeks time? And that brings us to the dessert of today, I would say, which is building strategic connections. Okay, LinkedIn is much less surprisingly about what you post, and it's much more about the internal side of LinkedIn. It's what everybody else doesn't see, which is why you would be shocked if you were to talk to some other doctors and see how long they spend on LinkedIn. I worked with a doctor one time whose screen time on his phone was 16 hours a day, and 5 of those hours were spent on LinkedIn. He's just all day on LinkedIn. He's having lunch, he'll check in. He's doing his little cardio machine and he'll check in. And the reason why he does that is because he's constantly working on those strategic connections. He's constantly speaking to other specialties that he thinks would kind of complement what he does. And I'll give you a concrete example of what I mean here. Let's say I am a physiotherapist, or yeah, okay, let's say I'm a physiotherapist. What I do is essentially I work with some patients who are maybe post-op, okay, they've just had an operation, and I work to rehabilitate them back into fitness. And other patients that I work with would be chronic pain patients, patients who are suffering sports injuries. So, what I would do if I was you is I would take a pen and paper, I would write my name in the center, and on that pen and paper, I would do arrows coming out of the circle. And I would write exactly who I could ideally work with, and who I could potentially work with, and who I am maybe in a crazy world work with. Okay, so people who aren't physiotherapists but are relevant to my practice. So that would be, of course, orthopedic doctors, that would be sports medicine doctors, that would be chiropractors, and all other specialties that are related to me. Then, after I've created the bigger categories, I would create smaller categories. So maybe knee orthopedics and spine orthopedics and general chiropractors, whatever it is, maybe little segments within each group. Then I would give myself monthly targets, okay? I would say, or weekly targets, however you choose to kind of systemize yourself. And I would say, okay, cool. This week I'm gonna contact 10 orthopedic surgeons, okay? And the way I find them is I go on the LinkedIn chat and I simply look up orthopedic surgeons in Dubai and I start connecting, okay? And people will start to accept your connection. And then you will message them something really friendly. Hey, doctor, I saw your page and I thought what you do is awesome. Can we, let's grab a coffee sometime or let's hop on a Zoom when you have some time. I am Nala and I'm a physiotherapist and I'm really cool at what I do, let's say. And a little kind of tip that I like to share with doctors is I once met a therapist who works with autistic children, and the way that she completely populated her schedule, she was booked back to back, is by doing one simple thing. every single day, she would contact 5 different people exactly who do exactly what she does. Imagine. So it's essentially your competitors, and she would send them a video of herself recorded with her phone just like this. Hi, therapist, this and that. My name is Nala, and I am an awesome therapist, and I do this and this and this. My special focus is this. I saw that we do the same thing. I wonder if we can grab a coffee and talk. And it actually turns out that people are really friendly and they do want to talk and they want to work together. So that was a really awesome way to create these strategic connections. So I would highly urge using a little bit of video content whenever you can. What it does is it kind of takes me back to the tip that I had shared previously, which is personalizing your personal brand. People want to see your face, they want to hear your voice, and they want to get to know you, the real you, outside of what you do. And to actually share the results of this advice, I think we have Mariam with us on the call today. We did a few consulting sessions with Mariam about her LinkedIn profile, and she skyrocketed her LinkedIn. I think she went from 100 some connections to now thousands of connections.
Yeah, it is. Hi, Nana.
Hi, Mariam. Sorry to put you on the spot.
No, I'm like, oh no. Yeah, it's true. Thanks to you, actually. Yeah, I went from 130 to this. So I followed up your suggestions and the videos and the messages and the follow-ups, and this is the result. Thank you.
Awesome.
Love
Thank you
the
so
call
much.
and WhatsApp me option on the right side as well. So that's really nice because some people just want to find potential colleagues on LinkedIn, but then they'd rather hop on a call, which we're a strong advocate of if you have the option to just speak, much better than just even talk on LinkedIn. But yeah, this is a beautiful profile, like your brand is very clear. And I love how it says helping individuals overcome fear and anxiety around medical procedures, slash holistic and coaching, slash emotional support and personal guidance. Why these words matter is also if people search, there's a simple search box in LinkedIn, and somebody is searching any of the keywords here, it will pick up your profile. So if somebody is searching for coaching, anxiety, Dubai, you will come up.
Yeah, and I really like Mariam's ability to combine her brand and her own face to the LinkedIn. I think also even what she's wearing well complements her brand. I know these are little touches, but they really do add something because if you can see that her background is very white, it's very calm, just like her brand, Companion. So everything together looks very aesthetically pleasing, and that really helps when people land on your page to have something that's nice to look at.
Yeah, and I love the book and appointment option as well. And I can see you have 1,051 followers, and I know this went up quite quickly. So on LinkedIn, don't be shy to spend an hour a week or a day, whatever you have. I know we don't have much time on our hand, but you just go in the search box and you type, for example, ENT doctor Dubai. And then you will have all the ENT doctors in Dubai that will come up, and then you just click connect, 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 connect. If you have time, you just add a personal note, which we recommend, and we're going to come to it. Hey, I'm Dr. May. I'm a pediatric dentist, and I refer a lot of my patients to ENT doctors. I thought it'd be great to connect on here. And you just copy paste that message. Your connections will go up super quickly.
Yeah, 100%.
Yeah, sounds great.
So how do you reach out? So if you don't have a lot of time, you just search, see who comes up, and then send connection requests to everybody. Connect, 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 connect to each person. If you have a little bit of time, which is much better, it's all about quality, not quantity.
Yeah.
So you just, when you click connect, LinkedIn will automatically pop up a window, which will say, add a personal note. So you'll say, yes, you'll click on it. And then you add this little personal note, for example, hey, I'm Dr. Shiva, I'm an aesthetic doctor. I practice here in Dubai. I can see you are as well. I love your page. I just thought we'd connect. Always nice to leave a compliment, which is suggestion number 3. And then, once you connected with that person, don't forget to like their content, engage, comment. I know you may not have time for that, but whenever you open your LinkedIn or your Instagram, remember that if you're just a passive follower or passive account, LinkedIn and Instagram is not going to favor you or like you too much. So the algorithms know that some accounts are more likely to click like or drop some comments, and that's going to favor your visibility. So try to be genuine and authentic when you like or comment. But even every now and again, just drop a few likes to the people that you really want to build a strategic connection with. Because remember that when you like, there's a notification that comes up that Nala liked your comment. And that reminds me that Nala exists. So that's giving me visibility about Nala. So that's a great way to have your name pop up into somebody's feed.
Yeah, I'll also add one small thing here as well. When you like somebody or you comment on somebody's post, what happens is LinkedIn has this awesome thing where it tells their entire database, their entire connections. They're like, this person liked this person's account or liked their post. So you're actually kind of doing yourself a public service there.
Yeah, exactly. So LinkedIn is a very friendly social network. It's here to help you and give you visibility. So use it.
I think Dr. Shiva, you wanted to say something?
Actually, I wanted to say the opposite of the thing that you said because what happened to me, because I have lots of connections. So actually, before I used to like a lot of posts, but now I'm very, very selective in that regard because it's also that you give visibility to that person, you know? So you
True.
should not like the people that are irrelevant to you or they have like significantly less connections than you, or, you know, that's also what I wanted to mention because for me it happened like before, like people even reach out to me and say, oh, you know, you liked our post and many people followed us. So after that, I decided to be very selective in regards to what I want to like. And also, if you like too many posts in one day of different people, it bothers people that follow you, and some people will unfollow you because of that. So be very selective. Do not like, this is my suggestion, do not like more than 3 or 4 posts a day scamming towards the people that follow you. So this is also something that I
3 to
experienced.
4 is definitely what we're talking about. So we're not talking, yeah, like 20, 30,
I'm
40.
like,
So yeah,
Oh, 30, 40 likes a day, you do.
yeah, no, 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 no,
no, no, no, we
no.
don't.
So
Oh,
yeah,
it's
our
because it's
point is
doing.
to just not forget to like. So I think it's very easy just to open the app and just see what everybody's posting and then close the app. And then you went on there, you used some of your time, but you didn't even send 1, 2, or 3 likes. So it's just remember to, if you see something you like it. I think it's easy
Yeah.
to forget, but yes, like be selective, of course. Again,
I'll,
quality over quantity.
I'll
Because
add,
see,
yeah.
I have one small point. See, for me, I have mostly connected other than mine. Like there are few people in my circle that do exactly what I do. So, for example, if I go and put a comment on, let's say, an internal medicine doctor or let's say an orthopedic surgeon, it doesn't make much sense. But what I do is that I reserve my comments for like medical stuff or like things related to UAE, things that are related to me. So I
Yeah.
reserve my comments for topics that are like not out of my niche. For example, if I go and even like an orthopedic, unless it's something, for example, a massive achievement, or for example, a certain surgeon has done certain thing, let's say for the first time in UAE or things like that. But other than that, like very specialty related topics, I avoid to like and comment because of this. And I prefer to stay in my niche and the things that I like, let's say medicine, fashion, things that it kind of aligns with what I do rather than
100%.
just going,
Yeah.
you
I
know.
mean, your voice on social media has to represent you and your authentic thoughts. Inauthenticity is the number one mistake that people make on social media because if you're inauthentic, you're going to sound like everybody else and you're not going to differentiate. So, 1000% stick to your niche, stick to what you like. But I will also add a comment on something that you said, Dr. Shiva, which is you do a favor to others if you like their post. And I think marketing and many other facets in life is all about that abundant mindset. Like there's enough patience to go around, there's enough likes to go around, there's enough comments. So actually by doing a service to somebody else, and this might be just a personal belief, but I think you send out a blessing into the universe, and I think that blessing comes back to you. And it's something I didn't used to believe in because competitive, let's win. But I've actually seen in my work that the more underdogs you help in the way of you trying to get to the top, the higher and the faster that you get there. So I wouldn't shy away from liking something where it's not as many followers are there. As long as you feel genuine connection to that post, do it. That would be my advice. I don't know if you agree there, Serban.
Yeah, absolutely. 100%. And you have to find your own style, like you'll see what works, what doesn't work. If you're liking, you don't get anything out of it, but just be receptive as well to how the platform is working for you. And there's really no right or wrong on LinkedIn. I want to insist on this. It's a lot more lenient and a lot more friendly platform, I find, than Instagram in terms of like the pressure that you put on yourself, of what you're putting out there.
Very true. Yeah, I really liked what you said earlier, which is that it's a friendly platform.
It is. Yeah.
Okay.
So we want to take some examples to get you thinking, because tonight we really wanted to focus on how to build strategic connections on LinkedIn. So again, maybe pen and paper or out loud brainstorming. Let's say you're an aesthetic doctor. Who should you connect with on LinkedIn and why? Can we have some ideas? I'll answer the why. So again, our recommendation is that using LinkedIn maybe to connect with clinics or other specialists that could refer to you, or yeah, that can be in your network, and like you can exchange referrals with each other. So what kind of specialist would make sense for you to connect with as an aesthetic doctor?
This is a question, or you will answer, or
Yes.
you're waiting
No,
for
no,
us
Yeah.
to?
we
We have
want
the
Ah,
answer, so we would like to hear it from you.
okay. So I'll give my experience in this. Okay, first of all, when I connect with someone on LinkedIn, I don't expect them to refer to me patients right away. They don't know me. They're not sure of what I do and how I do things. The point on LinkedIn for me is that I create the connection. I try to meet them in real life. I try to always be who I am, and I like impress them. For example, invite them to connect with me on Instagram. And then once they will refer to me patients without me even asking for it. So anyway, going back to who is the best specialties to connect with, for me, it's been mostly gynecologists, pediatricians, doctors who work with ladies mostly, of course, and transplant surgeons, for example. What else? I've mostly connected to these people, physiotherapists. Actually, one of my best friends is a physiotherapist, and she sent me a lot of patients, and she comes to my clinic to do stuff. And patients, they simply ask her, "Where have you done your anti-aging treatments?" And she just, says, "I've done it with this doctor." So it's most another specialty, for example, endocrinologists. I also work with them sometimes. These are specialties. I feel like there is more channel for referrals from us to them, and also vice versa. So.
Nice. Yeah, that's awesome. And I think I also really liked what you said at the end, which is like the vice versa factor. You definitely, when you connect with people, you don't want to say, send me patients, I want patients. I really agree, Dr. Shiva, you have to meet them in person, you have to, build a slight, professional relationship, and then you can maybe talk about mutual patient flow. So yeah, that's really awesome. Aesthetic doctors, endocrinologists, gynecologists, pediatricians, anybody who's really working with women, let's say. And even physiotherapists, you said. So that's really awesome. Now,
We have more examples.
sorry?
So let's say you are an OB/GYN doctor. So we don't have OB/GYN doctors in the group, I think, yet, but still we can have a little brainstorm. So this is an easy one. So if you're an OB/GYN doctor, who could you connect with and why? I love what Dr. Shiva said. Of course, the ultimate idea that you have is that you connect with other specialists to build referrals, but it's a long-term effort. Initially, you just connect, right? So who would be those specialists that would be good to have in your network on LinkedIn if you're an OB/GYN doctor and you're very busy obstetrician delivering a lot of babies every month? Who would be great to have in your network?
Lactation consultants, pediatricians.
Yeah.
Lactation consultants, great one. What about before the baby is even born? IVF doctors.
General practitioners.
Yeah, general.
Yeah, GPs, yeah. GPs would
So,
refer a lot to obstetrician, to gynecologists, family medicine specialists. Endocrinologists would be great because they deal with a lot of patients, that may have hormonal issues and might need to see an obstetrician and gynecologist for their fertility. And IVF doctors. IVF is a great connection. Once they get the patients pregnant, they definitely need to refer to an OB-GYN, especially if they don't have an OB-GYN in their practice yet. And same the other way around. If you're an OB-GYN specialized in IVF, but you don't practice obs and gynae anymore, you just specialize in IVF, then you need to connect with OB-GYN doctors.
and I'll give a special for both actually that relates to OBGYN and then also aesthetic. One important one that we forgot here is the beauty therapists. Those are the people who are constantly with the patients. And for OBGYN, it's got to be the nurses. You'd be surprised at how much nurses talk to patients. And nurses are very, very active on LinkedIn as well because they're constantly trying to find opportunities and move up, the chain. So they're actually, I've seen a lot of success speaking to nurses and beauty therapists from OBGYN perspective and also from an aesthetic doctor perspective.
Yeah, that is very true.
I think
Okay,
somebody
next.
and
Dr. Marjorie, would you like to jump in? We cannot hear you so well, but.
Okay. Are you hearing me now?
better, yes.
Can you hear me? Okay. Well, I'm Audrey Lantom. Internal medicine is my specialty. I'm very passionate about authentic wellness. Okay. Yes, internal medicine is sort of one of the what you can call the primary care specialties. But what I'm interested in is taking the patient to the next level by actually empowering them with that medical knowledge to make themselves better, because we all agree everybody is their best doctor. Good, right? So what I like doing is empowering you with that little critical information which gives you that edge to make those personal decisions for your health even better. For example, a lot of people just go and any supplement they see they buy. Okay, so let's get all the supplements together and let me tell you the best ones to do, which ones to eliminate and things like that. So in terms of my connection with other specialties, I find myself very useful, for example, even with the OBGYN case you're talking about, where yes, they are focusing on the woman, right? The baby and all of those other parts, but then sometimes they forget about the rest of the body of the woman. She may have diabetes, she may have hypertension, all those things. It's true, the OBGYN can take care of those, but they don't have the time to go through the root causes of those, some of those pathologies. So I enjoy that little aspect of not taking you away from your doctor. No, it's sort of giving you that extra, that smartness, something to make your wellness bag, your little trick of bags a little bit better and smarter. And in that, I enjoy enhancing other doctors' work. For example,
I love that.
so that your patient, yes, so that your patient gets well faster, and after the surgery, we get them out of it faster too. So those, a little bit of that.
That is a great point. So when you connect with those specialist doctors that you can add more value to their services or fast track their results, this is exactly how you would add that personal note and message, right? When you ask to connect. So you could just write once, like a little message that summarizes what you've just said beautifully. And you have like those 4 or 5 sentences, you keep it short. And I'm really looking to enhance the results that you have with your patients. As an internal medicine doctor, I could help with supplementation, let's connect. And then, like if you're posting every now and again, like your posts could all support this effort and this intention. So you could have a few posts that say, I see that a lot of, OB-GYNs and endocrinologists have patients who are struggling with ABCD. I love to advise them to have this approach, A, B, C, D. And then, they'll start seeing your post, understanding your methodology of work, and I'm sure they will become very interested in what you do.
100%.
So let's say you're a dentist. Let's take another example. So who could be a good connection for you to refer to, get referrals from, or as Dr. Marjorie said, add value to?
For myself, I would consider like speech therapists,
Nice.
pediatricians.
Nice.
A lot of pediatricians send me. I mean, I as a mom, first of all, I knew them, and it was a face-to-face meeting, and then we started referring to each other. Again, lactation consultants might be useful, ENT specialists, psychologists. Yeah.
Great.
100%.
So again, it's always nice to prioritize. So let's say these are your target list. Dr. May, you just write them down, 5 target lists of specialists. And let's say next week, you're just going to focus on lactation consultants. You're going to be adding a lot of lactation consultants to your network. So your post next week, even if it's just one of them and it's just a little text, no image, nothing fancy, your post can be about lactation. Why lactation consultant, and dentist should collaborate together. How can you enhance the results of lactation consultants, so that then they can see when they connect with you that you are really passionate about this and what is the value that you can add to them.
1,000%.
Okay.
And I'm also shortly going to share how you can speedline all of this and fast track it using AI. So I'm very, very excited for that section. Just to quickly add to dentists, you would also want to speak to endocrinologists, so people working with people with diabetes. You want to work with family medicine doctors because they're the doctors that treat you from when you're 6 all the way to when you're 90. So they're seeing all kinds of dental issues. There's really an array for dentists, and the beauty of dentistry as well is that it's so different from medical that nobody sees you as competition, let's say, because they can never fix somebody's tooth, so or teeth or any, it can be even something like the jawline, et cetera, et cetera. An interesting one is also ENT. I worked with a dentist who later started collaborating with ENT, and she became the main person to treat what's this the pain here? Dr. May, if you can help us there.
Mandibular
GM,
joint
Cleansing.
arthralgia. TMJ arthralgia.
TMJ, that's the one.
Yes, yes, yes.
That's the one. So that ENT used to see all kinds of patients coming to him with these types of pains, and he started referring to that dentist, and she got fully booked just treating that. And she said it's just a simple insertion of a brace. So she said they're really easy to treat for her, and she got really busy with that. So you'd be surprised at who can actually really help you fill out your clinic.
Great.
Awesome. So, okay, so let's I know we're running a little bit short on time, but I am going to share with you, I think, one of the most important bits of what we are talking about today, which is how to actually use AI to do everything we just told you. Okay, so let me just quickly pull it up and I'll share my screen again. Okay. So when I am talking about AI, essentially all I am talking about is ChatGPT for today. Okay, I'm not going to be sharing too many other ones, and I mean I will as we go forward. But let's talk ChatGPT for today to make things simpler. Now, the way you talk to ChatGPT is very important. It's called prompting. You give it a prompt. And essentially, you want to explain your whole life story to ChatGPT. And let's say I want to speak again as a physiotherapist, okay? Chat, I am a physiotherapist here in Dubai for the last 5 years. I want you to help me with strategizing my content for LinkedIn. I want to focus on creating strategic connections, and I want to create posts targeted towards doctors in my scope and patients in my scope. Number one tip, okay, that I would add here. Today we don't have the time frame to do it, but you have this recording so you can rewatch this part. And essentially here I would say, can you ask me 10 questions to help you perform this task? And then ChatGPT will come up with 10 questions or however many questions you want to answer if you have time. And it will essentially tell you exactly what it needs from you to actually perform this task better. Okay, I would do this for anything you're using with AI. It's a really, really awesome tool. Ask me 10 questions so that I can so that you can help me better. But today we're going to skip that part just for the sake of the presentation. Now, this is me explaining what I want to do. And I still didn't tell ChatGPT what I wanted to do for me. So if I were to press enter, ChatGPT would talk until tomorrow. So instead, I want to say, begin by suggesting to me 10 specialties, 10 types of specialties. By suggesting to me 10 types of specialties that I can begin to reach out to create these strategic connections. Okay, step number one. Now it will do that. As ChatGPT is doing this, what I want to also point out here is there's a new, let's say, thing to do on ChatGPT, which is to actually create projects. Okay, so you can create a new project, then you can call it, for example, LinkedIn, or you can call it Instagram, etc. And you can drag these chats into the different files here. Okay, so whatever chat you use today, whatever section here can always be saved. And the beauty of ChatGPT, I'm not sure if everybody knows this already, but it remembers what we talked about today. So if I were to come back next week and I'm like, okay, cool, I want 10 more posts, it's gonna keep generating the same type of posts. So it's
Nana, how you make it remember? Mine doesn't remember. I don't know why.
because you're probably not logged in.
How I have to change this?
Yeah,
Can you
so you have to log in. You have to create an account and log in.
No, I have an account. But for example, if I want to, let's say on Instagram, I've kept a very long chat. I keep typing into that. But if I open a new conversation, it's like it
Oh
doesn't
yeah,
recognize.
no, you
Oh,
can't
so
open it.
you always go to the same conversation.
Exact same. That's why you have to create files. So if I go here, if I click on this button, that's it. It's gonna forget everything. So it doesn't remember everything. It remembers whatever you do on each chat. And actually, that's a really useful thing because on every chat, you want to be talking about something else. You don't want to overwhelm every chat because sometimes I just want to know, if Chipotle is open in Dubai Hills Mall, and then I would have to open a new chat. I don't want to talk about it as a physiotherapist. So, um, by the way, Chipotle is open in Dubai Hills Mall. So, okay, cool. So now it gave me the 10 different specialties. Okay, orthopedic surgeon, sports medicine specialist, neurologist, rheumatologist, pain management specialist, etc. Now, the next part, which is my personal favorite part as a marketer, is for each of Oh, by the way, before I move on to my favorite part, I'll keep you hooked. Let me just quickly share something here. So essentially, after you do this, you're gonna go into your LinkedIn and you're just gonna write orthopedic surgeons Dubai. You can even just Google it, regular Google orthopedic surgeons Dubai, LinkedIn. And then a billion of them will come. And you can just set a target. Let's say every week you wanna do 5 or 10 or whatever it is that you feel you can do, just set a target and optimize towards it. And you can do it with orthopedic surgeons, sports medicine specialists, neurologists, etc. Okay, cool. Now, after I've built these connections and I'm connecting with people, it's time for me to then begin also posting a little bit to actually hook these people so they're the ones searching for me and not the opposite way. Now, favorite part as a marketer and favorite word is the pain points, okay? Okay, so now we're going to tell Chat for each of these specialties, for each of these types of specialties, oh, I want you to come up with 3 key pain points of the groups. Keep it short and simple. Okay, I always like to say that to ChatGPT, keep it short and simple, because sometimes it will really overcomplicate things and go crazy with it and take 6 years to perform it. So there's a really nice update here on ChatGPT Plus, which is it tells you exactly how it's thinking about things. It shows you the exact process of how it's coming up with the pain points, etc. If you're not a fan of how he or of how Chat did it or how he came up with the conclusion of what he did, you can actually tell it, I don't like the way you thought about this, do it again. And then it will do something else for you as a different option. Cool. So here it will give you the pain points. A pain point is something that's keeping somebody from their ultimate goal. So an orthopedic surgeon wants post-recovery to be really quick. They don't like that there's inconsistencies in some rehab outcomes. They don't like high re-injury risks. Essentially now, what you're going to do is you're going to fish for these doctors by putting on bait. Okay, so your post is the bait. It's like the little tiny fish that everybody wants to eat. And essentially, you're going to create posts leading with this style or with these paints to actually hook these doctors. And they're like, oh, this physiotherapist is talking about post-surgery recovery delays. I agree with that. Cool. I'm going to follow her or I'm going to talk to her. So the amazing part is, again, you don't have to do it because it's 2025 and we have AI. So here's what you're going to tell ChatGPT. I want you to create 10 posts for each of the types of specialties, leading with their pain, and I want you to end with a call to action to message me to speak. To message me to speak, get a coffee, something. You don't have to be so formal with ChatGPT, by the way. You can just do ... / You can really go crazy with it. Now here's a really key part to creating this content. Keep the emojis. This is a key prompt, okay? So keep the emojis to minimal. Add 8 trending hashtags, but keep all the hashtags in lowercase. Okay, because a lot of the time it looks like ChatGPT if you don't make all the hashtags lowercase. So keep the emojis to minimum, keep all the hashtags in lowercase, and I only need 8. I don't need 1,000,000. I want you to
For LinkedIn, you add 8 hashtags. It's not too much for LinkedIn.
8 is perfect. For me, I always add 8. There's no really right or wrong way. I'll tell you a secret about hashtags. They don't actually work. Since about 2011 to 2012, all of the major social media platforms really stopped using them. They use something called SEO, search engine optimization, which essentially is the algorithm's way of reading your text and figuring out if it's relevant to other people or not. Okay. The next important prompt is I want you to sound human, caring, professional. Oh, I don't know how to spell professional clearly. Okay. Professional and friendly. I also want you to use juicy and quirky language. Okay, I'm not joking. These are actually the best prompts to use to ChatGPT. I really do this every single time. I say juicy and quirky language. Optimized to garner views, likes, and start conversations in the comments. I want you to specifically tailor each post to that specialty and to speak directly to them as if you are me. Okay, so again, you'll have this recorded. So in case you want to take any more inspo, you'll have this to come back to, but this is exactly what I would do. Enter. See, it's taking exactly the exact prompts. I need to use human, caring tone while staying professional and friendly. The call to action should be inviting and simple, directly to them to grab a coffee or something. So it exactly shows you what ChatGPT is thinking and how it's coming up with the content. So this is really useful to just watch what's going on in the back end. Oh, sorry. So see, it misunderstood. It's actually making 10 posts. I did not mean 10 posts per specialty. I meant one post for the 10 specialties. So if you pause it here and you actually give it a different prompt, it keeps up. So okay, so give me my 10 posts, please. You don't need to say please, but
Nana, do you mind if I jump to the next ideas so that maybe once this is coming up, I can just run through the next slide? So
yeah. Okay. Let me pull up the slides.
Once we have the answers from ChatGPT, we can go back to it. So yes, but we have a few more ideas for you. So can we go back up to the what's trending in LinkedIn? So what's trending in LinkedIn is using AI to write posts, which is what Nala is currently showing you. And then making sure you schedule your content. So Nala will show you this if we have time tonight, or she'll drop a video on the group. And then we have something called audio events. So you can actually organize an audio event on LinkedIn. You can Google audio event on LinkedIn just to learn a little bit more about it. But this is valid if you want to organize an audio event, which is kind of like a webinar, but hosted within LinkedIn itself. And it's for you to share knowledge that you have that can add value to other specialists, or again, position you as an authority in your field. Like I said, for audio events, but also for ideas for your posts. So we took the example of an orthopedic surgeon who is collaborating with the physiotherapist in order to optimize recovery surgery session. This helps the two specialists to network and attract potential referrals from other specialists. So it's really nice when you post to not only post again about what you do, or when you organize one of those audio events, you can do it as a collaborative post. So you simply tag another specialist that offers a complementary approach to your treatment plan for your patients. And then you make a collaborative post. So let's say, again, you're Dr. May, you're a pediatric dentist. So you could post and say, as a pediatric dentist, I'm really passionate about breathing and airways. And I love to collaborate with ENTs on this topic in order to treat my patients with ABC. And then you can tag one of the ENT doctors maybe that you often collaborate with. And then I'm sure this will attract also other people to comment, who are related to this ENT doctor. And it's really showing, let's say, a broader scope to your practice. So it's very valuable for people. You're not just posting about your services, you're posting about collaborations and really like multi-specialty teamwork.
No.
Another idea that we have is on the next slide is build authority. So senior dermatologist or aesthetic doctor, for example, is making a post or an audio event, how to break into aesthetic dermatology, advice for young doctors or for junior doctors, advice for GPs or family medicine entering the specialty. And this would allow you to share career insights, answer questions from young aesthetic doctors or doctors interested to enter the specialty. So this is very valuable to build authority in the field. So same for so many of the doctors that we have here tonight. I know we have Dr. Mayur as a dermatologist. You could really start collaborating to share things that you've learned and attract maybe other specialists that are interested to know the advice that you share for younger doctors.
100%.
Last but not least, I believe we have another example. And this one, we don't see it enough, especially that we organize so many conferences and webinars, and you learn a lot of information from these events. So usually what doctors do after attending an event is they will say, oh, I attended this event last week and I was very grateful to be invited as a speaker. And then they just post pictures of them as a speaker. This is not as interesting as posting after attending this major conference. These are the key takeaways that I gained from the conference, that I gained from the webinar. And then you can just post 3 points that you learned that summarizes the research or things that you've learned. And I'm happy to share it with my peers who couldn't attend. This really positions you as somebody that is here to collaborate, which will really pay back in the future.
Yeah, 1000%. Maybe we'll
So
just
we
So
wanted
what
to make
happens is like you schedule it. Sorry, I'm sorry. So you schedule those audio events and then invite people, and then when it happens, it's like a Zoom meeting, but only audio. How does it work?
Yes, yeah. So it's a feature on LinkedIn called audio events. Like we'll make a note as well to show you how it works. But you know how Instagram Live works? You know, like those doctors, like a lot of accounts used to organize those Instagram Live. So basically, you're essentially coming up and then you're discussing a topic. And it will notify people that you're hosting an audio event or you can schedule it. So it's basically like a discussion, and you can even have slides, but I would say it's not needed. And you can discuss any topic that's of interest with peers from other specialties.
Okay, yeah, that's exciting. Yeah.
Maybe before we do this, let's quickly check on the. Okay. So, okay, going back to the post. So we have the first post is for orthopedic surgeons. Struggling with post-surgery recovery delays, inconsistent rehab outcomes, and high re-injury risks. I get it. With targeted physiotherapy, we can streamline recovery and build resilience in your patients. Let's share insights and transform setbacks into success stories. Fancy a coffee chat? Message me to connect. So this is obviously the first time that ChatGPT has learned about who I am and my brand. So this is not maybe the way that I want to sound, right? So I would keep prompting it. I feel that this is British sounding. I am whatever I am. So let's say I'm American. So for example, Americans don't say fancy a coffee chat. It's not an American thing.
So it's a bit too pushy, maybe.
Yeah, it feels too pushy. Doesn't really start a conversation and doesn't sound natural. I want you to sound like someone who's just having a thought about something, is genuinely passionate, and wants to help. This, to me, sounds too salesy. Try again. Okay, and while it's generating, we can go back quickly to the slides. So we're going to talk about what's trending on LinkedIn. Servan, did you want to take this or?
Yes, so LinkedIn has started to introduce what we call short form videos, which means just short videos, you know, sort of like 20, 30, 40 seconds, same like Instagram. We're not sure yet whether that's here to stay. Some people are saying that it's only a short-lived feature of LinkedIn, but that people who use LinkedIn don't like to see too much video content. They prefer to see written posts. However, we simply don't know because we know that generally in marketing, videos are more and more popular than posts. So when you open your LinkedIn, you might see that few doctors or accounts are posting short form videos. So if you already have some videos at hand that you quite like and love them, definitely don't be shy to try posting 1 or 2 on LinkedIn and see like what engagement you're getting. So it's quite new. It's come out like a few months ago, but it's basically a place, yes, where you can as well post some videos that you have for your other social media channels. Authentic content. So what do we mean by no polish photos? So LinkedIn doesn't really like generic photos that can be found, in image banks and libraries like Shutterstock. It should always be like real photos. If you want to use a photo, so a photo of you at a conference, a photo of you with a colleague, with an ENT doctor, photo of you with a patient, but don't be tempted to use like really advertisement photos on LinkedIn. It doesn't work. And you will see that if you do, you get a lot less likes than usual. Now, what's trending is CEOs and top level professionals are more and more active on LinkedIn. I have an example, actually, like CEOs of some of the top suppliers and distributors in your industry. You might see that they're very active on LinkedIn. They're posting, they're sharing personal insights. They position themselves as a thought leader. So you're a doctor, you're probably not a CEO, but you're definitely a top level professional. So it's a place where CEOs, clinic owners, influential doctors and researchers and professors really claim the space more and more. So here I'm just showing you a few snapshots of articles, in the news that are really highlighting how CEOs are more and more on social media. There's even been some reports that there's been a 35% increase in C-suite professionals in the US being on LinkedIn in the past 5 years. CEOs are also turning to video on LinkedIn. So there's a lot of evidence that top professionals are embracing the LinkedIn movement and even the video content on there. Nala, you're muted. And okay, sorry. So let me go to the next slide.
Yeah.
And back to ChatGPT maybe. Yeah.
Yeah, just quickly back to ChatGPT. Okay, so now it said, hey, orthopedic docs, I've been thinking about hurdles in post-recovery surgery, those delays. So I don't like, for example, hey, orthopedic docs. This to me is too casual. Now you're sounding, so it's really back and forth with ChatGPT until it gets it, by the way. Hey, now you're sounding too casual. Don't specifically mention the crowd that I'm targeting. Just hook them in with a nice sentence. Okay, and it will keep doing that and kind of keep going back and forth until ChatGPT gets it. I'm going to show you an example from my personal LinkedIn that it was actually written by ChatGPT, funny enough. And I'm going to show you that you can actually get it to sound quite casual and exactly like yourself. So I'm going to quickly read this for you. Growing up, I always felt like a disruption. I was the talkative one, the loud one, the kid teachers didn't know what to do with. They'd move me from one table to the next, hoping I'd settle down. But I'd just start a new conversation, connect with someone else, and spark another stream of ideas. I thrived on connection, always sharing, learning, and soaking up inspiration from others' thoughts and experiences. But at the time, I thought it made me different in the worst way. Why couldn't I just sit quietly like everybody else? Why couldn't I hold back my ideas, etc.? Okay, so this sounds very, very human. And this took, I want to say, 10 to 12 prompts of me being like, okay, now you're too casual. Now you're too friendly. I like this sentence. I don't like that sentence. So my point here is with ChatGPT is you gotta keep feeding it new prompts, okay, until you get exactly what you want it to sound like. And to wrap up this part of the ChatGPT, once you've figured out exactly what post you want to post, okay, you copy it. Okay, and you can do this in one sitting. You can now schedule all of 10 of your posts. So if you want to post once a week, okay, you're covered for the next 10 weeks. All you want to do is you want to go to your LinkedIn. You want to go create a new post. You paste that post. Okay, always make sure that it's all well aligned, that it looks nice and spacious. Maybe you want to give the hook its own space. And now instead of posting, you want to schedule for later. and you set the exact date and time you want to schedule it. Now, somebody earlier asked how often should I post on LinkedIn and maybe at what time should I post. LinkedIn, I would generally keep it around morning time, okay? Anytime from 9 a.m. all the way to 12 p.m. is fine. I would keep it on weekdays rather than weekends. I would also post about once a week, if not once every 2 weeks. I wouldn't want to bombard people with posts. I wouldn't want to be the type of person to be posting every single day. I do want to interact with content on the daily if I can. So that can be in the form of likes, comments, or just simply scrolling. Because even if you just scroll on the content and you genuinely watch stuff and read stuff on LinkedIn, you become favored by the algorithm. Okay, so you essentially, yeah, schedule all 10 of your posts and you're set for the next 10 weeks if you want to, if you want to post once a week. So that's how you can really, really leverage ChatGPT to
So
your.
it doesn't need a picture, just text.
You can do a picture. I do generally prefer pictures because I think it makes it more visually interesting. Pictures, I think we need to do a little Canva session at some point. Servan, I'll keep a note of that for us to kind of show you how to edit those pictures and how to get it in the format of LinkedIn. But yeah, if you have pictures that represent what you're saying 100%, the one thing I wouldn't do is to generate pictures on ChatGPT. I'm generally not a huge fan of that. I think it looks a little bit fake. There are other AI tools that you can use to create pictures, but they're quite pricey. So instead, what I would do is either post with no picture, or if you have a real life relevant picture, then I would definitely add that.
Yeah, and please, if you have a little go at some of the recommendations tomorrow, like I would love to see your questions to us in the WhatsApp group. Hey, this is what I created. What do you think? Is that good? Any advice? So, that's what we're here for. So these are just some directions that we give you. But of course, if you want some feedback, we are here for this. So we wanted to suggest an action list for tomorrow. Share what you learned today, or even just be open and transparent about your intentions with LinkedIn. Hey, I'm Dr. May, I'm a pediatric dentist, and although I created my LinkedIn account a little while back, I've not been very I'd love to start sharing more insights about what I do in my day-to-day practice. So I'm just taking this opportunity to reintroduce myself, for example. And I was inspired yesterday by a webinar that I attended. And this is what I learned about LinkedIn that I'm going to try and implement, and I want to share with my connections. Just an example. Update your bio. So the bio is the first thing we covered when we started this webinar tonight. We gave you the example of the personal branding lady and the ex-LinkedIn professional that have some really nice back cover image, and the little descriptive that says what you do, who you are, and what you're passionate about in your practice. Ask recommendations. We did not have time to talk about this tonight, but I'm sure we'll cover it in another webinar. This is kind of like the equivalent of Google reviews. Ask your connections to leave you really nice feedback about your work. So we'd love to take a few questions if you have any. If you're not a member yet and you like what we discussed tonight, you're more than welcome to join the community, apply for membership. And we want you to save the date for the next event, please, which we're very excited about. It's the next members event on Friday, the 21st of March. It's going to be at 11 a.m., not at 8:30 a.m. because it's Ramadan. I will then very quickly talk about your preferred day of the week for such events, because we understand Fridays are not great. But this event on Friday, the 21st, if you can make it, it would be great. It's actually a networking session where we're going to invite a lot of also new doctors from different specialties to attend. And it's literally going to be a networking session. So it's going to be for you to speed network and introduce yourself to other specialists who do different things in their practice than you do, and understand if maybe you have potential collaborations together so that they can refer to you and you can refer to them as well. So anybody in the group has any suggestions for the weekday that works better for those in-person events? I know Dr. May said that Fridays don't work. From what we hear, weekends are very difficult because some doctors have family commitments as well. Saturday is also quite a busy day in the clinics. But is there any other weekday that would work better or well for our members who are still with us instead of Fridays?
For us, I mean,
Friday, Saturday, Sunday are very busy, so any other day will work.
yes, for me, like Mondays are the least busy days. Like as of now, I don't even work on Mondays, but I don't know if that's the case for everybody.
Yeah, our research was showing that yes, Mondays and Tuesdays are slow days in the clinics, and then it picks up towards the mid to end week, right?
Yeah, for us, that's the case.
Okie dokie.
Yes,
Well,
true.
thank you. There was a lot of information in tonight's webinar, so we're definitely going to post the recording, and I would really encourage you to listen to it again and just take it step by step. Don't try to implement everything at once. Just start with something that you like tonight, and then you can get back to us for the next steps. Thank you so much for attending, and wishing you all a
Thank
beautiful evening.
you.
Thank you to Nala for all the great tips shared too.
Thank you. It was really good. Thanks.
Thank you, everybody.
Thank
Have
you,
a lovely
Speak
night.
Safe. Bye.
You too.
Bye-bye.
Bye.